Today they're having the official Health Facilities Planning Board public hearing. Local mayors, other representatives from the state and federal that were here, along with, the doctors, the nurses, the first responders, the fire, police, all community businesses all coming together to testify what this hospital means and what it will do to this community in terms of if this shuts down, from the economic impacts to the healthcare impacts.
The transport times that we're going to incur is going to cost people lives, and it's not acceptable.
The reality is that minutes matter, and 10 miles, which could be anywhere from 15 to 20 minutes, could be life or death for someone, depending on the incident that they're participating in or happens to them. Whether it's some major trauma, maybe they are shot or something like that. God forbid, something like that. They have a heart attack or a stroke. I mean, healthcare teaches us that minutes matter.
Save our hospital.
All of the shootings that we've had, and I know, we hear it on the news on a daily basis. And the people here, they come to MetroSouth. And as they were speaking here today, the doctors was talking about the shootings that they've gotten here at the hospital and how they saved a person's life within 5 minutes. Other surrounding hospitals are 10, 15, 20 minutes away. And time is very important.
50,000 visits per year to MetroSouth in its ER room. Where are those people going to go? Where are those patients going to go if this hospital closes? Ingalls can't handle that load. We know Christ can't handle the load. Roseland can't handle the load. So where are they going to go? We're centrally located. Our main thing is that this place needs to continue. New owners be allowed to take over and not allow the present owners to leave it with all its assets from our community.
What they can do is, if they really work with the community and really talk to us, we could talk about how they can transform this facility, because there is a need. There's no question that there's a need. When we hear the stories of surrounding hospitals continually going on bypass to their emergency rooms, which means they can't take any more people, then you can't tell me that there's not a need in these communities for this facility to help ease the burden of some of the other area hospitals. So what we hope is that they'll push off their application and give us a real opportunity to talk and to come together where we can talk about the transformative nature of what this hospital could be. We know we need mental health services here. We know we need opioid and drug abuse services here, in addition to just regular hospital services here in the south suburbs. So we can have a real conversation about how we can transform this hospital.
The hospital's been here for decades and become a huge economic engine to the city. I'm afraid that if we lose this pension, Blue Island will become a ghost town with no hope to recover.
We have restaurants that really supply services for visitors here. We have stores that offer products. We have florist shop. We have, again, restaurants and other businesses that thrive. And the employees of the hospital, over 800 employees are affected by this. And they also spend money here. They buy gas to go to and from. They shop here and they support the community. And we will lose this if they close the hospital.
Christina Iliopoulos, who is the owner of DeMar's restaurant, she shared, that they have 15 employees, and 60% of their business every day comes from employees of MetroSouth and from people that are visiting their relatives and loved ones there, and they're ordering breakfast and lunch and dinner. So to have that sort of threat of loss of revenue is certainly something that would be devastating to her business. And unfortunately, she's not alone. As we think about our business community, there are a lot of folks, T&G, Flowers by Kathy, Tenochtitlan, all of our restaurants, Iverson's, everyone that's really right here around the hospital would really see a decrease in business if the hospital were allowed to close.
There will be no farmers market. Because the hospital comes out and supports the farmers market. The hospital supports everything. There's a group of businesses right now trying to bring back dog days. It's all about the hospital. The hospital and this community works together.
This community needs this hospital. Changes need to be made, and we need to work together to make it work. We understand that a hospital cannot function without proper finances. However, it's not just about the dollar, but it's about the people who need and deserve the care.
I think this is a important part to having the Health Facilities Board delay this so that it gives us some time so that we could put together a plan to keep this emergency room open and what could be utilized here if it's not a full service hospital, what type of services and healthcare services that could provide so that the community, not only here in Blue Island but in the surrounding areas, have a place that serves the healthcare needs.